Okay, friends. Uh, so today we are discussing a very important part, that choosing anesthesia as career. I think most debatable, if you ask me, currently, and maximum queries I get students regarding this. So we are starting this session. Okay, fine. It's going well. Technically, it's okay. I think now only 6 people. What I can see is has joined the chat. So should I wait for a minute or so? I'll ask. Should I continue? Just let me ask the technical team. Just to confirm from technical team. Okay, fine. Okay, then everything is fine. Okay, let's start. Like, first, my encounter with anesthesia. So your queries will take later, no problem. So first, so your queries will take later. First, we'll go with the presentation, and then whatever your queries are there, you are most welcome. We'll try to solve as much as possible. So now my encounter with anesthesia. This is important, so because we all pass through the same stage regarding our awareness about anesthesia. Like if I tell you my story, that how I opted for anesthesia as a career, it was not an accidental, which often happens. It was perfectly by choice, and in spite of getting every branch, I chose anesthesia. Why? Our awareness about anesthesia is really very I'll say minuscule. Like when we were also calculating total number of seats, and why I'm telling you this, because these things will solve majority of your doubts, because I know that currently the most important, and I'm really getting lots and lots of queries from the students are at my rank, I am only getting anesthesia, what should I do, because I never thought of taking anesthesia. So these kind of queries you all are going to face when you will appear for counseling, and every one of us pass through that stage. That is why I'm telling you my story also. So in our college, Rohtak Medical College, there were only 32 seats of post graduation, 2 MD anesthesia and 2 DA. So when we were calculating the number of seats, we 4 students were preparing, 4 friends were preparing together. So when we were calculating the seats, we always used to stuck at 28, and then we used to think, hey, 32, then what happened to 4 seats? Then somebody, oh, we forget to add anesthesia seats. Oh, so that was actually, it was never coming to your mind also. And that's all story about you also. You all people are also perfectly unaware about this anesthesia, and forget about unawareness in general public. Even medical fraternity I am talking of right now, we all are medical fraternity, we are talking in that situation also, that anesthesia never come to our mind when we talk about seats. So what happened? I got a reasonably good rank in PGI and AIMS 134 and 108, and then after giving my NEET examination, and our time NEET examination used to be called as All India. So after giving NEET, or All India rather, I was so pretty sure that I'll be getting a good seat, so I stopped studies. So I thought of that I'll not prepare for a state examination, because I was 110% sure that I'll go through. Exam was excellent. And so what happened, I went to the medical college to find some house job till the result of this All India came, and it usually comes after 6 weeks or 8 weeks our time. So that time only house job available was in neurosurgery. So anyway, I had no option, I had to just pass my 2 months. So I joined neurosurgery. And you know, in neurosurgery, my only job was to please anesthetist. And in fact, I was being given a, you can say, budget for that also. Like taking care of anesthesia residents or senior residents, so that cases can be done. I mean, pleasing them by not bribing, but giving them tea parties, sandwich parties, paying their bill for cafeteria. That was actually my job. So then I really started to realize how important this branch is. Like, one person is totally dedicated to ensure that cases go smoothly and case rejection is less. So then I started sitting with the anesthesia people and started to realize the importance of this branch. Then I really realized that we actually only see face or arms, but we don't see spine. Anesthesia and critical care is actually the spine of any hospital. Hospital cannot work, it will crash without this branch. Any other specialty, if you don't have pediatric specialty, you can run a hospital. If you don't have one specialty, you can run. But if you don't have anesthesia and critical care, then definitely you cannot run a hospital. So it's a backbone. So that was a time that I started to develop interest in anesthesia. So and so that in those 2 months, in fact, I decided that I'll take only anesthesia. And that is how anesthesia became my choice, which was not even, say, even in the deepest part of my brain, that branch was not there. And those 2 months totally changed everything. And I decided I'm going to take anesthesia. So that's how I encounter anesthesia. So, and why I told you I'm telling all this, because your awareness is so low that majority of you will be hesitant to take anesthesia because you are not aware about that. And we are too much underexposed to anesthesia. Even in OT surgical postings, when we go to OT, we all know the scenario. We try to see what is happening in surgery, but we actually will not understand. How will understand? Because nobody will allow us to see the surgery. Even OT nursing in charges, you know how they treat students or interns. Stand 6 feet away. So you are standing 6 foot away and try to see the surgery. So what you will see, eventually you will see how was the spine of that surgeon. The surgeon was looking fat from back or lean and thin from back. That is what we see only in surgery. We even never bother to see that there is some person sitting near the anesthesia machine and doing something. Hardly it comes to our view. So that is how, I mean, I chose to be an anesthetist. Now, obviously, this question, many of you, this question is going to run through your mind: should anesthesia be chosen as a specialty? Okay, let's start. First, we'll start from income point of view, because that is the most important thing I will say. Eventually, at 11th hour in life, what it matters? Gandhiji is the most respected, or dollars or pounds, they eventually become most important thing. So let's start from income point of view. Yes, I do agree that from income point of view, anesthesia is not that much highly paid branch as compared to other countries. But it is not only about anesthesia. In fact, we will discuss Indian scenario also in terms of money. Medical specialty as such is now become very less paid overall. So I'm not only talking of anesthesia as such, but yes, other countries, see, this is US Bureau of Labor Statistics. Anesthetists are most paid than any other type of doctor. So anesthesiologists are paid more than any other type of doctor. This is the data of US Bureau of Labor Statistics 2019 latest. So in US they are highly paid or highest paid. Same thing is Australia. Anesthetists, this is Australia data. Anesthetists are highest paid group in a specialist, super specialist vascular surgeons. And you know, they are super specialist and the income difference is not really that significant. $385,000 and $444,000. So in a specialty, anesthetists are the highest paid group. That's in Australia. Okay. Then UK, if we talk of UKC, anesthetist average income is around $4 lakh, and you can compare with other branches. Dermatology is paid higher than anesthesia, then medicine, nephrology and orthopedics are even higher paid, and ENT. So you can say that among all these specialties, anesthetist almost and cardiology also, yes. So around fourth, so they are in the first 5, you can say, even in UK. Now let's talk of India. So in India, see, this is anesthesiologist stands second in the list of the highest paid medical professions. Okay, so still they are the second. But the catch is that majority of the surgical field they have considered as surgeons. So compared to surgeons, yes, anesthetists are less paid, or but still much better than any other specialty. And this is Career India, that average salary is around 12 lakhs, 1 lakh per year. But then in this data, when I went in detail to find that they have included senior residency, or even they have included anesthesia as postgraduates, and they include all India data where, you know, states they had included, not this is private sector only, they had included government service anesthesiologist also, and then they took the average. So that's why average is around 1 lakh, because government, you know, salaries, then medical colleges they have also included, and medical colleges salaries are not really exorbitantly high, particularly these small medical colleges nowadays. We sorry to say, but we have now colleges which are really very small. And so anyway, so that is still still is the second highest paid. Now second, anything obviously other than money comes your job opportunity, scope of job. From a scope of job point of view, settle instantly. This word I like to emphasize is instantly. You can actually settle instantly, and that I'll discuss again in later in detail. Now job ratio of anesthesia and critical care to any specialty is around 5 to 6:1, and that's true. Like if in anesthesia, if you say how many specialties we are dealing, if we start calculating our department, only I'm talking of anesthesia, OT, gynae, general surgery, orthopedic, eye, ENT, then all super specialty surgeries, urology, or your cardiothoracic, neurosurgery, plastic surgery, and then so many surgical branches, and for all those surgical branches and procedural also, like radiology, we are also very frequently going for MRI CT in pediatric or claustrophobic patients. Then endoscopic suits we are very frequently going. Accident emergency for minor procedures we are going. So considering all these infertility centers we are going. So considering all these things together, minimum, this is not an official data, I actually could not find any official data, but that is what I calculated from some hospitals where I have worked. Requirement of anesthetist compared to any branch is around 6:1. Same way critical care. If you add critical care to this, then this ratio may become in 7 or 8:1. And that is actually a question. I know very common question I encounter from students is, sir, look at the number of seats. We'll discuss how many seats are there in anesthesia. I do agree. Number of seats compared to any other branch is high. Maybe more than 10,000 or 12, 13,000 seats are there, including DNB, everything. But look at the requirement also. If in an institute, if you see a new institute, if some recruitment happens, you will find they will ask for 4 people in surgery department, then they will be asking at least for 15% in anesthesia department and another 6 or 7 in ICE critical care. So number of seats are proportionately being increased. So don't think, don't go by number to compare with the other branches, because job requirement is high, so number of seats in anesthesia they have increased. That's a very common doubt. Now, so let's see the pros, advantages. Scope and income point of view I have already discussed. Scope point of view, number of jobs point of view, yes, it will be definitely highest in any institute. Income already we have discussed. Major economies, US, UK, Australia and US number 1, UK around 4th or 5th number, and in India also 2nd. So income point of view, this is also a reasonably good branch, or rather India reasonably good, outside perfect. Like in Australia, the most difficult task is to get anesthesia. They will evaluate you like anything to give you anesthesia. Similarly in US, in our time they were not giving anesthesia at all, but the shortage becomes so much that there was a time in US that 60% of the anesthesia was given by nurse anesthetists. So they become less you can say hard on selection. So they started to give expatriates also. So that way it's definitely good. From international point of view, if you ask me, rather I won't mind using this word, from international scope. There's no doubt that this is still, I'll say, is the best branch. International job demand in current day practice is maximum of the anesthesia. There is no second thought about that. Then you earn in early part of your career. This is also important. Actually, when I chose anesthesia, obviously at my rank in state, I was getting every branch. So obviously I have to face lot of resistance, and resistance was to an extent that even when I told my family, my father, that I have taken anesthesia, he was not very educated, so he couldn't first understand what is this anesthesia. I told Behoshi ke doctor. Then he was shocked. What? You have doctors for Behoshi? You need some doctor for Behoshi? What is this? And what this branch you have taken? Have you gone out of your mind? Go and change your branch, take anything, but not. So much resistance was there. And another very interesting story I would like to tell you here is regarding awareness. I was during internship, through some common family friend, I was in touch with a girl, no affair, just family commitment, and both parents, they decided that once these kids they get post graduation, we may consider them for marriage. Anyway, she was also preparing, I was also preparing, so I could manage to get through All India, but she didn't. And through All India, I had already taken a decision that I am going to take anesthesia. I took anesthesia, and after taking anesthesia, then I spoke to that girl, because their state exam was to be 6-7 months later. So I spoke to her and she refused. She said, "Oh, I can never think of marrying an anesthetist. So sorry, I will not be able to go ahead." Anyway, that was a level of awareness, and that was a point actually I started to think about that. Anyway, that is, but anyway, I was so determined, and by that time actually I have done 2-3 months in anesthesia also, already joined that, so I started to love that branch also. So there was no question of changing the branch, and then a state exam came, so she insisted that why don't you take another branch, but of course I was not ready to take that branch. And then there is a part 2 of this story also, not only sad part, happy part also, or encouraging part also. Then finally through state she could manage to get a surgical branch, and after say 3-4 months being in surgical branch gynae for few months, she realized the importance, like what I realized the importance of anesthesia after working 2 hours in neurosurgery. And then she contacted me and she said, I have no problem, we can go ahead. But anyway, that didn't work out. By that time I have moved on, so it couldn't. But that's what I'm telling you, that's how actually story happens about awareness. And when you come into the hospital scenario, when you join the hospital, then you start to realize, particularly if you join the surgical branches. So I was telling, when I was about to join anesthesia, or I joined anesthesia, then there was a lot of resistance from everywhere. My parents, my friends, everywhere, what branch you took. So obviously you will also start to think once. So I went to one of us, very senior consultant in Gangaram. He was family friend of us. So he just asked me one question: whether you want to earn in early part of your life or late part of your life. I said early part. So said, okay, forget it and take tea and take anesthesia. We will not discuss over it. So that's true. You can earn in early part of your career, but there is a disadvantage, there is a catch to it that we'll discuss in cons. Now, latency curve of learning is short. This is an advantage, but however, this is a disadvantage also that we'll discuss later. That latency curve is short means you are ready to work from the very beginning, means you have learned that field. I started my freelancing after just finishing my post graduation, and I could manage very well, because in anesthesia learning procedures are very limited. So you can learn very fast. Only thing is you will refine, you will learn complications, and that is a separate scenario. But learning curve is short, so you can start earning very fast. Like surgical fields, you know, sometimes learning basic procedures which can survive you in practice can take 5 years, 6 years, 7 years to get a confidence that I'll be able to do that. And you know, you all know that getting even a senior residency in a government institute in Delhi, or I think a big institute like Mumbai, is something like picking a rupee coin from a river. So difficult. So learning becomes very difficult, but that part is not there in anesthesia. In anesthesia, very soon you want your juniors to work, while in surgical fields, juniors just crave to get work. So that's the advantage. Learning curve is short. Then anyhow, if you feel like that I am not getting recognition, I am not in a clinical branch, then there is exit route, and that exit routes are critical care medicine and pain management. So you can always offshoot if you are not happy, or you want to you realize that I want to be in touch, direct touch with the, in anesthesia also you will be touch with the patient, you want to be in touch with the relatives, and patients should realize or the relatives should realize. So then there is always critical care and pain management, but that carries its own advantages and disadvantages that also we are going to discuss. Now let's expose to public. You will be surprised to see that why I mentioned is as pros. This should be con, or this should be disadvantage. Yes, this is disadvantage, but advantage also in current scenario. You know the current scenario of India, where public is really so much outrageous that facing public is really becoming a tough time. Anybody can anytime abuse you, anybody can anytime thrash you. So considering these scenarios, yes, this was not an advantage 20 years back, but today I find that this is an advantage. That comparatively, yes, scheduled life. Comparatively scheduled life, once you are out of your work, you need not bother about patients. This is something very important that you will realize later. Like when I was doing freelancing, and when I used to go with my surgical friends to a trip or something, their trip was like they are not on trip. Continuously their phone will keep on ringing, and continuously they are on phone, so they will not able to see that what city they have even passed many times. In anesthesia, that's an advantage. Once you are out of your duty, then you can even switch off your mobile phone, because you don't carry long-term commitment of the patients. Otherwise, for surgical branches or medical branches, like if patient is admitted, or surgical branches, post-op also patient will always be behind you, and he is your responsibility. And yes, then spends major time in pollution-free involvement, because OTs, they all have laminar flows, filtered flows, HME filters are there, and this is, you may find it may be little weird at this stage, but this is important, that at least every day you are sure that you are getting the purest air for 7, 8 hours every day. So this is something important in current day scenario, where pollution level and has so tremendously increased. Cons, the biggest con, or you can say for which people are actually reluctant to take anesthesia, is working behind the curtain. So they means you will not be known to public. So therefore my strong suggestion is, this is not a branch for the people who are desirous of recognition. So if you are very much desirous of recognition, you want recognition, so then definitely no way this branch is for you. Fine. So this is the most important thing, because majority of you at student level, you have not seen life. So things may be totally different after 5 years, 10 years, when you will come in the market and see the scenario, your views changes. But this time all of you will be thinking, oh, I will not be known to public, so what is the advantage of doing medical profession? Yes, if you are so much concerned about this, then definitely this is not a branch for you. I told you short learning curve is an advantage, but it is a disadvantage also, because you earn fast but achieves plateau. So a graph of an anesthetist may be like this. You earn fast, very fast, soon, and then you will achieve plateau. So you will be mostly hovering around this plateau, and maybe when you become old age or less efficient, then maybe graph will reduce. But for surgical branches, yes, graph is slow, and then it has started to rise, and then it will keep on rising like that. So that is a disadvantage, that you achieves plateau. And this actually short learning curve, I tell you, this has become a disadvantage also, particularly nowadays in corporate sector, because in corporate sector, the corporate people, they have realized that there is not much difference in anesthetist who has 8-10 years of experience or 20 years of experience. So that way they ask even a 20-year anesthetist to work at the same salary, because they know that learning curve is not long, is So competency differences will not be much, so that means you become fixed at that salary. But in surgical branches, you grow and you are valued because you is not about competency. Competency, in fact, in private sector, if you ask me, private sector competency does make a difference, but more important is your monetary value. So with the time, your clinical practice will expand. It's slow, but when it expands and you are really very good doctor, then definitely your popularity will keep on increasing, and more patients you will have, more and more you will be valued with the time. But this is a time process. It take a decade at least, and in that decade also there are only few percentage who achieves this peak. But yes, if you achieve, then you are really you can be sky high. So yes, one advantage I told you, less exposure to public means less possibility of thrashing, but disadvantage also that your context will be comparatively less. Public relations or context definitely will be very less, while in clinical branches you can definitely make your good contacts, and context does make a difference also in India particularly. Then in corporate, I told you, you are not considered as direct revenue generators. Not, I will say revenue generators. Revenue or hospital cannot work, but you are not, they don't consider them as your direct revenue generators. So comparatively, yes, less valued. However, there is a rider attached to it. Corporate only, or any business, not only corporate, corporates are pure business sectors. So their value is related to how much income you can generate for the hospital. Okay, so that is their only criteria, and so that is why who will generate revenue will be valued. But how many? Like if we say really brands in any of a clinical branch, you can calculate on your fingers. They are valued and they are getting a package like anything. And the problem is, like majority of my colleagues, juniors, I have seen that in that hospital they will just see those 5 or 10 big shots surgeons or physicians, or for that matter any other branch, and we start to compare ourselves with them. We are just seeing that is just a tip. Behind that tip, we forget to see that there is a one surgeon who is given a package, and in his team, if there are 20 people, look at their packages, look at their struggle, look at their frustrations, that we don't see, because they also want to achieve that peak, and out of that hardly 5% or 10% will be able to achieve that peak. So anesthesia, yes, you will not achieve that peak, you will not be, you are not going to reach at that, but yes, moderately you will be nice. You will always be at moderate level. So in conclusion, from the career point of view, I'll just like to summarize. If you want a decent, reasonable life, clearly I said decent means comparatively balanced, reasonable means not very highly paid you will be there. I'm talking of now Indian scenario. Outside you are highly paid also, but let's talk about India, keeping majority of us going to settle in India. So from India point of a reasonable life, and from the beginning of career. Fine, then go for anesthesia. But if you have sky touching ambitions, then please, this branch is not at all for you. Then prefer clinical branch, and in clinical branches, if you ask me, surgical branches. Definitely, eventually highly paid will be the surgeons. Surgeon, I'm not talking of, don't consider surgeons mean general surgeon. I'm talking surgeons means everything, orthopedician or neurosurgeon or gynae surgeon, means all surgical fields, I'll say. Then better opt for surgical field. Fine, if you have very high ambitions. Now, just few more concerns I like to add. Career as a freelancer, because I know, because when you are taking this branch, lot of questions will come to your mind. So career as a freelancer, and I am able to answer this because I have passed all through stages. 7-8 years I have worked as a freelancer, and I have seen the advantage, disadvantage of freelancer. The only advantage is earn very fast. I'll emphasize this word, very fast, from the beginning. Like if you ask me, whenever we all do a post graduation, we just have a image income in our mind. So in my freelancing, after 6 months or after 1 year, I was earning more than 5 times of that, or maybe 10 times of that what was my imagined income that time. So that was a thrill. That really gave me thrill for few years, but not long, because freelancing has many disadvantages also. So early part of career, yes, it may be very good because you earn very fast from the beginning, but yes, disadvantage is highly unscheduled life. All the time 24/7 into 365 you are on call. Unsafe practice, yes, very small nursing homes, you don't even, that time even anesthesia machine was a luxury. So that becomes unsafe practice, and yes, maybe underpaid depending on the supply and demand. Fortunately, our time in supply demand story, supply was less, demand was more. So we were reasonably paid, no doubt about that. But now this supply demand story is little reversed, there is no doubt about that, and or at least balanced. So maybe you can be underpaid, or difference in specialty. Sometimes you do very difficult case and you are paid very less, and a surgeon who for him surgery was very minor, but being a surgeon he was being paid more. That's these kind of things do happen in freelancing, because it's all about value. If there is only one surgeon in that area and he is good, he is having good hand, so he will be paid more. Nursing home clearly sees if there are 4 surgeons and 1 anesthetist, then they are going to pay anesthetist more and surgeon less. So it is that sort of thing. So these kind of you can say disadvantages or problems you can face if you are working as a freelancer. If you are working in an institute, then life is definitely peaceful, safe practice. Not only you are alone in other OTs, you have people to help. If there is some complication, you will get many peoples, and you will have level 2, level 3 seniors on you. So you are comparatively less liable, and no difference in specialty. So in an institute, I am talking of a government institute, not private institute. Government institute, if you are assistant professor of any branch, your salary will be same. If you are associate professor, your salary will be same. So that branch differentiation is not there. So I am talking of government institute, not private institute. This difference is there. And of course the cons, less money. Then career as an intensivist, yes, it's a sort of clinical branch, because you are in directly touch with the relative, you are doing counseling of the relative every day, and job scope is tremendously high. Like anesthesia, intensivist jobs are numerous, and this COVID has made that the requirement of an intensivist has become so tremendously high. So, and this really opened up avenues as an intensivist. Now many people will opt for intensivist in future. So job scope is really very high, but comparatively unscheduled, not that much. If you are working in institutes, not that much unscheduled, but comparatively I can say this. I should not have used this word, but this is a truth of India getting thrashed. After accident emergency, if you see maximum thrashing, or you can say maximum jinx happens with the critical care doctors, because critical care, myth in people are like that they think that they are, particularly private hospitals, nowadays even government also it's happening, but private, they think that means even if you are putting in a ventilator to save the life, they think they are putting it for earning money. And thanks to some of our actors and big movies who portray like that also, that dead bodies are kept in ICU for many days. So that pathetic situation, and this is a general opinion even in educated. I have seen I'll tell you one experience of mine. Once there was an old man, and his son is a lawyer in Supreme Court. So we are trying to intubate. He was needing intubation. So I called that family for discussion. I said, we need to put your father on ventilator, it is necessary. So you know what was his answer? And he's a Supreme Court lawyer. His answer was, doctor, why you are discussing? We know that why you put people on ventilator. We know very well, indication is not there. So don't need to discuss, you have to earn money, go and put my father on ventilator. That was his answer. Anyway, I'll not go in the detailed story what happened later. But that is a journal opinion. So that is a disadvantage, I'll say. And for the very same reason, medico-legal hassles are comparatively definitely more, because death either will be in emergency, accident emergency, or in ICU. So medico-legal hassles, patient complaining, and lodging complaints, that also will be maximum for critical care or accident emergency. As a pain specialist, I have also worked 1 year exclusively as a pain specialist also. So again, you can say it's a clinical branch, and scheduled life means at least you will not be getting calls in the night or odd hours. So you can have comparatively scheduled life. But the disadvantage is poor patient satisfaction, because mostly patients coming to us are for chronic pain, and chronic pain is non-treatable actually. You can give some relief, but once the patient has paid you money, then there is no word like some relief. Even the pain of the patient dog should also be treated. His dog in family should also not have pain, because he has paid you. So that is the attitude, you know. So once patient has paid you, there is no way, even if you explain. I have seen people are clearly explaining that you will get only 50% benefit, and still they are fighting. We have paid. They'll say, no doctor, we have paid. No, but I told you that you will be getting 50-60% relief. Forget about doctor what you told, but I have spent 20,000 rupees, so I don't know, I will not listen anything. That is what now attitude has become. So less pain satisfaction. And disadvantages of a clinical branch. So clinical branch has disadvantages. It has advantages, no doubt, no second thought about that. But disadvantages means you will always carry patients with you. Like patient, if you have given a block, even he will call you any time to ask what he should do. It becomes their right. Anytime, odd hours, on phone call, they will keep on calling you, like this has happened, this has happened, this has happened. So even if you are outside on a trip, like you cannot afford to switch off your phone like in anesthesia, you can. That I wanted to say. So if you do that, then you will lose your practice. So you have to satisfy patient whenever he or she calls you. Now another very important thing, MD versus DNB versus DA. Very common question. Advantage of DNB, easy to enter. Disadvantage, difficult to exit. Entry is maybe easy, but difficult to exit in the sense that 50% of the chance will be there that you will fail. So pass percentage is somewhere around 50%. It used to be 20-30, but now 50-60. So average around, you can say 40 to 60%. MD, yes, difficult to enter in the sense you need good little better rank, but easy to exit. Pass percentage of MD is really very good. And anesthesia, I'll say it is the best among all branches. And even in jobs, abroad also I have working, that MD is preferred over DNB, mostly MD is preferred. Even abroad I am talking of. Abroad, in India, maybe little people, if they are aware and they see you have done DNB from a good institute, they may. But abroad still they consider MD to be little better than DNB. So what, if you ask me, a take home message regarding MD and DNB, DNB is an option if you don't get MD from a reasonable institute. I attached a rider. Institute do make a difference. Like if I say comparable institutes, then MD definitely preferred. If it is a government institute, then MD definitely preferred. But yes, if you feel that institute is really a private medical college with no facilities at all and very poor infrastructure, and in that case you are getting DNB from a good institute of Delhi or Mumbai, then definitely I'll say and you are confident that you are good in academics and you will be able to pass, then in that case I will say DNB is preferred. But largely overall statement is yes, MD is preferred. Now DNB versus DA, also many questions are asking, many students are asking me. So I put 2 greater than. There is no second thought about that, because I know many students, they say, sir, I am getting DA from a government institute but DNB from a private institute. Salary difference is also there. So forget about that. DNB, because after DA you will be frustrated, I am telling you. There is only one, you can say, one place where there is no difference in DNB, MD and DA, and that is freelancing. If you want to be a freelancer in life, yes, it doesn't make any difference. If you are competent enough and very good at maintaining relations with your colleagues, surgical colleagues, then definitely it won't make any difference. That is the only place. Otherwise, if you want to go abroad, DA will not be considered. If you want to join a medical college, go in academics as a teacher, professor, associate professor, DA is not considered. So overall, considering disadvantages of DA, I'll say always prefer DNB. And all DA I have seen, they eventually try for DNB after a few years, and then they add 1 more years, and after reading after 5 years becomes very difficult. So I always say DNB. So in general, take home message regarding these 3 specialties, I mean 3 branch is MD most preferred, DNB. However, I told you institute also can make a difference but not much, so prefer is definitely MD. And DA, obviously, if you don't have anything and you have exhausted your attempts and you think I will not reappear for any exam in future, already 2-3 trials I have done, or last time my rank was better, this time rank has deteriorated, then go for DA, because there is always a way out in DA that you can do DNB. Now choosing a college, very important question. Many of you will ask me, sir, I am getting this college, should I get or not? I have seen very weird, in fact, queries from the students. Not, I'll say weird, because at that time your awareness of life is not there. So I will say, but so I shouldn't use that word weird, but yes. Sir, I am getting, in this college I am getting ophthalmology, in this college I am getting MD medicine, in this college I am getting dermatology, in this college I am getting anesthesia, in this college I am getting X branch and Y branch. Many queries I get. Just take a point from me. College is going to be with you for only 3 years. Branch is going to be with you for life. Actually, I won't mind saying that branch is your bigger spouse than your real spouse, because with your spouse in a day hardly you will be spending few hours, otherwise you will be sleeping or both are busy in your household chores. So but with your branch every day you are spending at least 7-8 hours. So branch is the most important thing to decide. So choose branch. College is secondary thing, that's my take. So branch is the most important thing, because if you don't love the branch, college will not be with you after 3 years. Branch will be there with you for whole life, then you will regret. So first preference should be branch. Now if specifically if you ask me anesthesia, that is also very common, sir. DNB is this institute, DA in this institute, and MD in this institute. Yes, DA there is no second thought. DNB should be preferred, that already we have discussed. MD and DNB, yes, if you find there is a gross difference in college, I told you, because now we have those kind of, unfortunately, colleges. Our time there used to be only 98 government colleges only, and I think 20 or 15 very good private colleges like Manipal or Ramaiah or those kind of. And now we have 558 medical colleges, and some medical colleges, sorry to say that they are, I don't know what to say about that, but they are there. So If that is there and you are getting MD from there and DNB from premier institute like Medanta or Gangaram or some Apollo Chennai or some Apollo institute, then definitely I'll prefer DNB, but that's only extreme. Generally it is MD. So in nutshell, what I'll say is choosing college is not that important in anesthesia. So don't worry about that. If you get a little less college, doesn't make a difference in anesthesia, because there is not that much learning procedures. Learning is there, don't confuse with learning. Procedures are less. So even if you are doing your post graduation in a small institute also, still you will be able to do lot of procedures which are sufficient, and you can always compensate with your senior residency. You can get senior residency in anesthesia comparatively very easily. So whatever the deficiencies in college were there, that can be compensated in senior residency. So don't worry about college much in anesthesia. Now the most important thing, at my rank, what I will get, MD, DNB or DA. So this actually was lot of effort, and I'll really like to thank DBMCI staff, particularly Dr. Gandhi, for working so hard to get me this data. It's not that easy to get these kind of data. So I'll show you that data. That can really give a very good idea. So this is a round world data of last year. See, anesthesia, I don't know whether it will work or not. No, I don't think it will not work. So anesthesia at first rank was taken by rank holder 1327, and that's obviously in medical college, Maulana Azad Medical College. So 1300, the first person opted for anesthesia. Then you can see, if I scroll it down, in Delhi, if you say around 4000, you are also getting Delhi, Mumbai. So this is how, I mean, just to give just an idea, 5000, like if I say at 5000, you are still getting Delhi. At 5600, you are still getting Vardhman Medical College, Safdarjung Hospital in Delhi. Then let's go around 6000. 6000 also, see, you are also getting Delhi and Bangalore Medical College also. Even Nizam is there. Then at 7000, if we say, to just give an idea, you see you are getting GMC, Grant Medical College, at 7000. And then let's go to the next 8000. 8000, you know, SGPGI you are still getting. So that's something really, I mean, it's a good institute. Then if you go in the 9000 range and we see what all good institute still we can get, you can get Lokmanya Tilak Medical College, Mumbai, Tata Memorial you are still able to get, BHU you are able to get, and Rohtak you are able to get. Now if I go say at 10,000 also, if I say some good medical college, Rohtak still is available. Then GMC Nagpur is there, KGMC Lucknow is there, which is really a very good institute. So in 10,000, like at 11,000, if you see, still Kolkata Medical College is there. Then Indore is there, Surat Government Medical College are there. So around 12,000, if we see, 12,000 still you are getting Bhopal Medical College, Gandhi Medical College. Then around 13,000, yes, still you are able to get Raipur, Bikaner, Gwalior, Ajmer. They are also reasonably good regional institutes. Around 14,000 also, you can say one Mumbai seat is also there, Silchar, Kolkata, and so there's around 14,000 you are getting MD medicine in Assam, and DA last seat is around 17,000. 17,000 rank you get DA. So this is just overall idea. Now this master sheet will explain you everything. So this is AI All India General category, and this is the total number of seats. Total number of seats is around 1394, and this is the rank. C column is rank at which you acquire this seat. Then This is the last person who got it from all categories, including reserve category. Like say this 92,000 ranker, what he got? He got OBC in BHU, number 9. So that's reserve, rare. Otherwise, normally general category, if you see, so general category maximum ranker got anesthesia as 14,000, that we already have discussed in Assam, 14,900. And the first person he opted, we discussed, is 1327, and total seats in general category 683. So 1300 seats in anesthesia is not really, people say seats have increased. Even I think in surgery also they are around 1200 or something. So it's not really high as far as number of you can say requirement of jobs is considered. So general category 683 seats, and up to 15,000 you can get. In physically challenged, up to 75,000 you can get. OBC up to 13,000. I think this is the most important thing you will be interested in. Rather, who was the first one, that's not you must be interested. Up to 13,000 in OBC category you people got. In scheduled caste category up to 33,000 rank. In ST category 53,000. This is about all India. Then AMU around 20,000. BHU 64,000. OBC I told you 92,000. Then Delhi University around 11,000. In open you can say OBC 12,000, ST 46,000, and IP University 39,000, IP University OBC 54,000, SC 80,000, and NRI if you have more money to pay, then even up to around 80,000 rank you will get anesthesia. Now second question is DNB. So DNB rank you can also see in 2020. Round 1 people up to 24,000 rank they got. Round 2 same 24,000. Round 3 28,000, and there were little increase mob up also around 28,000. So I think this will be very helpful for you to give you an idea that at what rank you should be able to get. That is a most common query I get from students. So I think that should be that should have answered your majority of the queries, but still if you have any queries, I am opening my chat and see if there is some specific query you can ask me. Himanshu Sharma, what income one can earn with freelancing? That depends on city to city. Like because see, rates are varying from city to city. Like if you ask me in city like say Gurgaon, I belong to Gurgaon. So Gurgaon, the new people which have joined now recently, one of my colleagues, and they have established their practice in 2 years or so. So after 2 years of their established practice, in and around they are earning approximately around 3 to 4 lakhs easily. 3 to 4 lakhs. Some are going even 5 lakhs also, but average you can say yes, 3 lakhs can be earned in a city like Gurgaon, 3 lakhs, 4 lakhs. Parveen, I am interested in anesthesia, interested in seeing patients. So Parveen, I just want to ask you one thing. Sorry, not Parveen, Pawan. If you are interested in seeing the patients, why you want to waste your 3 years in anesthesia? So I will not suggest you that you go for anesthesia. Go for any of a clinical branch, and you want to open your setup, then definitely clinical branch. There is no second thought. Why will you do anesthesia and then open your setup? So my take, if you have not opted yet, then go for any of a clinical branch. But if you are already in anesthesia, then opening hospital, even our country does not stop you for opening a setup, even if you are a rickshaw owner also or a auto rickshaw owner also. You should have money to invest. People will there. All big hospitals, not all, but majority of big hospitals are owned by businessmen, they are not related to medical profession. So to open a setup, you need not be in the medical profession also. Fine, I think that should answer. So Himanshu, I told you. Another question of Himanshu, what income one can get with DM after MD or DNB anesthesia? DMU means super specialty neurosurgery or that thing. Difference is not a very significant, honestly, if you ask me. Like, say, yes, compared to MD DNB, yes, advantage, that depends on your level. Like beginning level, like you are working as in, say, I say starting with attending consultant. Senior residency, it will be sale. Attending consultant difference will be just 20,000. Like attending consultant average salary will be around 1.25 to 1.5. So you will be, maybe you will getting 20,000 extra, 25,000 extra maximum. MJ, sir, no use of studying this hard, because at the end of the day these OBC as a people will take our year. So this is a political thing, MJ. So actually the thing is, MJ, I don't think you should take it like this. You just think that what is available for you. If you will think that way, I don't think you will be really able to be happy in your life. See what is available for you. So available for you is that you have to be in 14,000 if you want anesthesia. Other specialty, I don't know how much till last it goes, maybe I think 24,000, 25,000 you should be able to get something, because DA around 17,000. So you have to see what is available for you. That should be the attitude in life. For you, you can say 15,000 seats are available. So why you are looking for someone, say 74,000 or 30,000, because that's not available for you. For you, availability is 15,000. So you think that I have to be in that 15,000. Khalas, then only I will get. So look into your basket. That should be the principle in life. If you look into other baskets, what's happening around, then you will never be satisfied. So Aman, already I have answered, freelancing. Priyanshi, how to approach anesthesia residency like any other residency? Like anyway, no problem. You join, I'll prepare another small lecture or a small presentation, how to deal with anesthesia once you get it. So I'll try to arrange on YouTube later once counseling is finished, how to deal. But no need to worry, how to deal is, see, and again, Priyanshi, I like to say why to think of so much. When you have passed your examination, enjoy. You are one step ahead. How to do that thing later, when it will come, you face it and do it. So don't think so much, just enjoy. Himanshu, sir, anesthetists have a stressful life during OTs. There is actually, I define anesthesia in a very simple manner. Miles and miles, thousands or hundreds of thousands of miles of fly with moments of terror. Anesthesia job is exactly like a pilot job. You know, turbulence happens rarely, but they happen, then they jolted you out. There's no doubt about that. So anesthesia, majority of the time life will be very smooth, because complications do happen but rarely, and major complications very rarely. So largely it is not stressful, but yes, there are moments which are stressful, and that's not about anesthesia, that's about every branch. Surgical traumatology, yes, lot of scope is there, Anup. Trauma, lot of scope. If you are interested, you can opt for. Delhi College for 8,000, yes, we saw that is a list, I mean it's. How difficult is to crack CCM with new changes in SS exam pattern by anesthesia resident? Not very difficult. If you have really done a honest study in your MD, then I don't think. It's not that difficult. Rohit, can a Gurgaon anesthetist income be correlated with Bangalore? Rohit, really largely I think in major city yes, because yes, why I can say, because I have one of my friend in Bangalore and he was practicing. I haven't met him for many years now, but that time his income was yes more or less same like Gurgaon. So I don't think difference will be more than 10%, 20% maximum. Divya, I think already I have explained lot of things. Anesthetist lifestyle depending. If you are a freelancer, life is very hectic, I already told you. But if you are working in an institute, then life is perfectly balanced. But money will be less. Himanshu, clinical specialist and anesthesia specialist have more stressful life. Himanshu, I'll just tell you one thing. Stress in life depends on how you take life. Even people have committed suicide by losing just, I think that time you were very small, Harshad Mehta scam was there. These some scams do happen in India, this share market scams. People for 50,000 or 1 lakh rupees loss, they committed suicide. People, students of just, they can't bear the torture of ragging, they commit suicide. So this is actually depends on your personality, that how you take stress. So it has actually nothing much to do with the branch. More or less stress for everybody in life, I'm not only talking of medical profession, is more or less same. It depends on your personality. So that is why we say, we always ask about marks of a student. In childhood, what is our success criteria? Marks. In life, what is our success criteria? Money. We never ask what personality you are, how you are able to handle stress. Tier 2 cities, yes, you can definitely, Mangpai say, if Gurgaon, whatever I say, considering it as a city, then tier 2 city will be definitely around 30% less. I think so. There is no actually exact data I have exactly, and income will vary, because in a same city, one person may be earning 4 lakh rupees in the same freelancing, second person may not be able to even earn 2 lakh rupees. So depends on your luck, your personality, your level of hard work, number of factors. So income, I like to tell you, income is not just dependent on one factor. Many our colleagues who could not manage get PG are earning far more than you. They have opened nursing homes and they are calling super specialist. So super specialists are behind them. Some people who could not even get to qualify for medical, and their shops or their businesses are running so heavily that they are earning like anything. So income is not only dependent on one thing. There are many factors. Stars. Your stars does make a difference. Then your approach towards life, how much hard work you are ready to do, so many factors. Divya, I think you ask again same question which I said we should not ask. Among ENT ophthalm anesthesia, you cannot compare A, B, C. This is on your personal preference. See, anesthesia, one I like to say, yes, clarify at this point is, if you love surgical branches, if you love to be a surgeon in your life, and I'm telling you, surgeon means any surgery, ENT, eye, ortho, gynae, any ABC surgery. If you want to be surgeon in your life, then don't go for anesthesia. You will be frustrated, because you will be always looking at that side. So it cannot be compared. If you want to be a surgeon, like say, if you have watched carefully, ENT surgeons in UK, they are, I think, number 2 or number 3 in earnings, the data we showed. So we can't say. So it depends on your personal preferences. How difficult is FRCA and going to UK after MD anesthesia? If you compare all other branches, then it is easiest to go in anesthesia, and maximum jobs are in anesthesia in UK, maximum. So yes, getting FRCA is not easy, but the rewards of FRCA, once you get an FRCA and get 3-4 years of experience in UK post FRCA, then your salaries in you can straight away eligible for Australia. Maybe UK you are eligible for doing private practice. Gulf countries you get hell of a salary after doing FRCA. So it is tough. You have to study very hard. But yes, it's not that difficult. People do. I think that should be able to answer all your queries. Later also, if any queries, you are most welcome. So should I close the session? I think nobody is typing. Any other query later you also have, you can mention and you can discuss with me, no problem, anytime. Okay then, thank you very much. So I am just signing off.